Hello. Today I'm talking about urinary incontinence. Urinary incontinence can be caused by two things. One is stress, another one is overactive bladder. Stress incontinence is usually caused by increased pressure on the urinary bladder due to lack of support on the urethra. Overactive is caused by muscles having increased contractions. So the two things have two different ways. While one is saying that you have given birth, you sneeze, you cough, anything to do with that, you are actually having a stress incontinence. If you jump, you will leak. The other one is overactive bladder. You put the key into the door, you are like, I gotta go pee. Then that is overactive bladder talking. You see clouds in the sky. People think they gotta pee. Sometimes it's something like dropping somebody off to a bus stop. It may cause the urge to go. The reason overactive bladder is different from stress incontinence is stress incontinence just keeps going. It is all physiological factors that cause it, versus overactive bladder is muscles are contracting and you're unable to figure out how much the bladder holds. Sometimes it might be only a drop or two, sometimes it might be a whole bunch, and you are unable to manage the time and say, okay, I'm going to pee 5 minutes later. So that control is not returned back. With both um, stress incontinence and overactive bladder, the most important part is to remember to do Kegels. Your doctors can help you if you are consistently doing your Kegels. If you need information about the Kegels, make sure you look up my previous YouTube video about pelvic health. It will help you to understand the exercises more deeply. Right now, I'm working on some stretching that is so important for people to do while they have an overactive bladder. One of the most important things that I teach people is to lie down on the mat like this and open their legs. As they open their legs, they're supposed to breathe in and breathe out. And do that for good 30 seconds. You have to let your knees fall onto the side of the floor, and that will help you stretch out a lot better. If that is very hard to do, you could lie on the bed, put your leg out to the side, and let it drop out. If you drop it out, let the thigh go to the side, and that'll stretch your inner thigh muscles quite a bit. Another exercise that I tell patients to do is stretching. So you're going to be on your hands and knees. For young people who don't have hip issues, this is easier to get on the hands and knees. But for older people, I'll show a part B of how to do it. For those who can, try to stay like this. And then you're going to lean forward. Stretch your SI muscles. Breathe in and breathe out. And then breathe in and breathe out. Then come back to the position. Do that 3 times. Stretch, breathe in, and breathe out. Okay? So the next one that you're going to do, if that is very hard for you to do, grab a chair. The chair is in everybody's houses. You can take it, put it in front of you. And usually what I tell people to do is lean forward and stretch. When you lean forward and stretch, you're stretching your upper back muscles and all the muscles that are attaching here. So you stretch it for a good 15 seconds and come back forward, okay? And then do it again. Lean forward, stretch it. If you want to make it harder, lean your arms forward and stretch it out like that. The more you're leaning it forward, you'll feel a good upper back stretch. And that'll be very important for you. All right? Another thing you could do, I'm going to turn the chair around. For those who are difficult to lie on the floor, is going to put their foot up on the chair, stretch it out, lean forward, nose over toes. You got to feel a stretch in the bottom of your, behind your knee. Hold it for 30 seconds and then let it go. Okay? Swap the leg, do the other side. All right. There are so many facts that can be done. Kegel need to be practiced as recommended in the other program. I would always start only with 5 repetitions and build up my tolerance. But I want you guys to remember, do it diligently. If you practice diligently, it actually is more effective. Once you have reached 80 repetitions, I want you to build up that 5-second hold to 7-second hold. Don't run up to 7-second hold because I told it today. You have to watch the previous episode and it'll make it a lot more easier. Another important thing that I forgot to mention is there are foods that are irritant for urinary incontinence. One of them is wine, another is chocolate, spicy foods, soda. That is everything that a Malayali eats. That's me. So I recommend not eating spicy foods. It's very, very hard, but you need to tone it down a little bit. It kind of triggers the bladder to pee more. Carbonated carbonated beverages, sodas actually have increased sugar. So sugar in general tends to make you want to pee more. So try to avoid that when you're having a day where it is too much. And even like when you're not drinking enough water and you're drinking a cup of coffee, you're dehydrating your body. So try to drink enough fluids so that you can have your cup of coffee is my recommendation. Don't drink espresso. That is a no-no. Not the coffee, regular coffee. The espresso is a no-no right now if you have incontinence. Don't forget to do the Kegels. If you have any questions or concerns, it is important that you talk to your primary doctor, not just to the therapist. They have medications and they have other procedures that they can do to help you. For stress incontinence, there are surgeries like sling, birch, and bulking. They're less medications, and they actually, I've seen a couple of patients who had bulking done, and they do not have leaking, not even a drop of leaking. Overactive bladders, the medicines really work if they are medicated properly. Botox, a couple of patients did have Botox and they really were doing well. Neuromodulators is another one that they recommend. Tibial nerve stim, and I do. I had like 2 patients who had the nerve stim put in for neuromodulators, and they completely did not have any problems sleeping through the night. So I know these mechanisms for incontinence do work. If you have any questions or concerns, text me in this. There is another video that I recommend people watching. It's by Christopher Turney, the doctor from UCLA, MD, chat. It's very informative, and he has all these diagrams and pictures explaining all the procedures, which might be more beneficial for you. And it might make you assess whether you want the medicines or whether you want a sling put in or if you want to do the e-stim. So I'm personally a fan of e-stim because I'm a physical therapy assistant, of course, but up to you guys. What do you guys want to choose? Alrighty, that's all for today. Take care. Bye.